SIU Family Medicine in Decatur is a 555 residency, so we have 15 residents total. So small enough where we get to know everybody, you get to know your families, and that's another big pull is it truly is family medicine. We're a family and community medicine residency, and that's in our title, so being able to have that community outreach is huge. Having the local docs as a support, being able to have our research and scholarly activity, our point of care ultrasound, having our community outreach, obstetrics, and the osteopathic recognition have all been big parts of our program.
The thing that stands out about our program is the size and the fact that we're unopposed. But with us being unopposed, we're the only residents, it means that we get even more hands-on individualized learning from all of our specialists. Honestly, since we're unopposed, there have been so many things that I never thought I would ever do. We get to do colonoscopies when we're on our general surgeon rotation, first assist in a lot of orthopedic cases when we're on ortho and sports medicine. In some days, I'll actually be running like the scope cameras. On another day, I'll be opening and closing. And then our smaller size means we're a very tight-knit community, which helps making sure that everyone's taking care of one another and no one gets lost in larger groups.
We are an osteopathic recognized program. We have several osteopathic residents currently. We have an integrated osteopathic clinic where we do our osteopathic manipulative therapy for patients here in Decatur. We're the only providers in Macon County that do OMT. Decatur Memorial Hospital is a very supportive institution for us. It's where we do all of our inpatient rotations, and it's who the residents are employed through while they're here with us. They love having the residents. They're the only residency program that this hospital has, so they really get to be the one and only in the hospital. They're really invested in the residents. They want them to stay here in the community and to continue to practice here. They want them to be successful, so they give us as a program a lot of resources and support to be able to provide high-quality education for those residents. We have a really strong, robust point-of-care ultrasound curriculum that we've developed here to really give residents a foundation in how to do these skills when they go out into residency and incorporate that into their practice. So we have that as a longitudinal curriculum that goes throughout their entire 3 years. I think the other strength that we have as a program is our OB curriculum. We have a lot of opportunities for residents to get involved in obstetrical care and women's health, whether it's women's health procedures that we do on the outpatient or taking care of pregnant patients. We get to do our own continuity deliveries and really have an impact on the community in an obstetrical way.
We have our didactic Fridays where the residents have protected education time, and once a rotation, so once every 4 weeks, we have the residents spend an hour going out to the community. We have that broken up into different partners throughout the community where they get to see their patients in our community in different settings.
The pod structure is our clinical structure that we have on the clinical side on our outpatient clinic. And that is set up with a team where a resident is in a single team with a single nurse and a faculty member so that they have some continuity as far as who they work with during their 3 years, which we think is really important as a program to give them that nurse provider relationship so that they're working with the same nurse, because that nurse and the provider relationship is really important, and we want them to have that consistency so they can build that team and sort of learn how to communicate and work with each other much like they will when they go out into practice.
Besides medical knowledge, I feel like my confidence, not only just like as a person, but also as a doctor has grown a lot. And that's because of the support that we get, both internally with our own attendings and externally with our outside preceptors.
I want to be an advocate for my resident. I want to know how they are doing truly. We go through residencies and we have core competencies that we have to meet, and of course we want them to obtain all these different skills, but I want to know them on that personal level of how they're doing and how do they learn and how can I help support that. They are the main star in this, so how can I help advocate and get them to be the physician that they want to be?